Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning in to the latest edition of the Checkup. With more than 1,700 locations in 46 states, Kindred Healthcare has a unique perspective on caring for patients during the COVID-19 pandemic. Their network, as most of you probably know, spans long term care, rehabilitation, and behavioral health. I'm pleased to be joined today by Kindred President and CEO Ben Breier to talk about Kindred's approach to caring for these patients across so many different settings and so many different partners that they work with. Ben, thanks so much for being with us.
Well, thanks for having me. Good afternoon, Matt.
So let's talk about that. Spreading of best practices is kind of where I want to start with you, given that you do span so many states, so many locations, you work with a lot of other provider groups. Can you talk about your approach to trying to spread best practices across such a vast network in the middle of a pandemic?
Sure, I'll be happy to. And it's been a challenge, as you might
Yeah,
you might expect. Standing up, I think everybody forgets. Like most of us, our health systems, we almost overnight had to set up virtual support centers, and we all sort of take for granted maybe 6 months later the technology and the people that we've deployed to do that. But I remember, we had planned for it a little bit back in February and early March, but when the day actually came where we said, let's turn the light on and stand this thing up, it was quite a task. And obviously, 6 months later, I'm pleased to report how successful standing up our virtual support center has been. You talked, Matt, in your opening about the fact that we don't just do business in one market or in one state, but we have the unique challenge of providing healthcare in 46 different states. And it's been sort of fascinating, not just the infrastructure side of how we set things up, but actually to watch as the COVID-19 pandemic played out across the country. We do business, of course, up in the Northeast. So we saw the Northeast corridor go first, particularly in New Jersey and New York. We've seen it spread, to the Midwest and out West. And then, of course, most recently over the summer, all of the big rise in Florida and Texas, which are, two of our largest states. And so we've had to build upon the progress that we've made around the development of our infrastructure each time to make sure that we were carrying out, sort of that consistent operational mission, if you will, across the country. I think, one of the things that we did early on that has been so successful in terms of managing that platform across the country is the creation of a very formal incident command structure that we set up. We knew right away that we should create command and control, from a central perspective, so that we could make sure that we were gathering the critical, flow of information, make decisions in real time, particularly clinical, decisions that we had to make with our clinical response. And then, like so many people, Matt, I mean, we had to early on make sure that we were managing the supply chain, managing particularly in those early stages of the virus, what was happening from a PPE perspective, where we were getting it, how we were deploying it, what we were going to do with it. As you know, we are in some of our businesses a heavily ventilator dependent company, and making sure that we had the right stock and that they were in working order. We actually wound up allowing and donating ventilators to people who needed them so badly. We spent a lot of time on the federal and the state regulatory, side of the world, making sure that those things were in line. I think managing your balance sheet in the early stages to make sure that you have the financial wherewithal to survive something like this in a time when none of us really knew, well, what's reimbursement going to look like? Are we
right.
going to actually get paid? Are things going to slow down? And first and foremost, just making sure that we were finding a way to protect our teammates and protect our patients and make sure that whatever we were doing, that we were going to try and keep those folks safe. So, I mean, I think generally that was sort of the strategy that we deployed early on to make sure that our platform worked really well across the country.
And because you're in so many different areas, and not all of it inpatient, and when I say areas, I mean clinical areas, and you're not in that direct inpatient acute setting, you do have the inpatient rehab. But as you think about, the again, the patients that you were seeing and across so many different states, were there some lessons learned if we hit a phase two of this, a surge two, are there some things that you're going to do differently?
Well, I think there are some things we'll do differently, and I think some things that we will continue to hopefully try and promote that I think history will show that we really did perform quite well. I mean, I think when you move past some of the sort of initial setup infrastructure type things that you and I just talked about, And we started to get into the early and then middle innings, if you will. I don't know, maybe we're still in the middle innings of how this is all going to play out. I think the one thing that we sort of foundationally learned was that our long-term acute care hospitals and our inpatient rehab facilities and our acute behavioral health hospitals, the specialty hospitals that we run, I think really in many ways turned out to be an ideal setting to be able to handle this really sick, really medical complex patient. How do you isolate a patient? How do you take care of a patient that has multiple system problems? How do you deal with a patient who's on a ventilator or who might be suffering from stroke or neuro rehab needs or who might be paralyzed from the disease? I mean, these are things sort of at our core. Our facilities are really good at and able to provide. And I mean, I think we learned pretty quickly that the value of what our value proposition was, maybe rose even higher than what we might have originally given it some credit for. One of the things that I think served us so well in the early stages as hospital systems, to your point, as inpatient hospital systems, were so concerned about ICU bed capacity, med-surg bed capacity, as they were, expanding into, tent hospitals and all the things you saw, is that we immediately became an outlet for a lot of those patients to be moved out of those ICUs into, our longer-term care facilities.
Right.
And really help decompress a lot of the things, that happened. But I would say if you asked our physicians and our clinicians, there's so much that we learned about how to care for the disease, about how to test for the disease, about how to isolate and make sure that we were also caring for all of the other patients that continued to be in our facilities. And so, I think that if we can build upon both of those, we'll be well prepared, both for what we are currently seeing and what we'll see into the future.
I'm curious on the behavioral health front. This is there's the physical element of COVID, but the behavioral health piece is impacting people in so many different ways. As you look across the Kindred network, are there things, 2 or 3 things that have really percolated to the top in that marketplace?
Well, one, I think there's a tremendous awareness that it is a growing need. I mean, we've talked about behavioral health now, haven't we, as a country, as it relates to
Right.
the opioid crisis, as it relates to some of our kids and some of the things that we're dealing with. But boy, I mean, when you get into a pandemic of this sort, and you've got people who are already suffering from these kinds of things that now become even more acute in the way that, depression might set in and the way that social isolation might set in. I would say that's the biggest thing that I've seen as really sort of this unique effect about quarantining and staying at home, is that so many of our patients and so many of our prospective patients that have been socially isolated from others are really suffering from it, Matt. And if we are not proactive, and many are being more proactive, and there are lots of, I think, unique things being done by both the provider and the payer side of the world, and even the federal government, to try and get at some of this. This pandemic around this virus, I think, is going to turn into a pandemic around the mental health of so many of the particularly, more elderly and exposed populations in our country. I mean, even today, we really don't allow visitors to come into our hospitals and visit their loved ones. And that human touch, I mean, we do our best with connecting people digitally and through social media, but it's just not the same. And so I think that, we are all in need of making sure that we are putting together the right apparatus to get patients aware of these mental issues and deal with them earlier. And certainly we don't see any slowing up, if you will, of what's happening on the acute behavioral side as it relates to our business.
Well, I think it'll be interesting too, given the growth of telehealth and the advances that we've made, and everybody's talking about making some of these telehealth changes permanent. Not forgetting that some of this behavioral health piece really needs an in-person human touch element and not just telepsychology or telepsychiatric.
It really does. I think telehealth is a fascinating technology and really a fascinating subject for all of us to talk about. To some degree, it has served and will continue to serve, I think, as a tremendously growing platform that we can do so many wonderful things. And I suspect as technology evolves, we certainly use telehealth in many, if not most, of our Kindred facilities today. We use it for tele-ICU health. We use it for telebehavioral health. We are doing a lot more virtual visits than we've ever done. But it's sort of the same discussion. I mean, I hate to sort of make this analogy, Matt, but it's sort of the same discussion about all of us who are working from home. we miss being in the office. We miss human contact. We miss the touch of the social interaction that we have of
Right.
being one-on-one with people. And I certainly think that while telehealth will continue to play an important role, it is no replacement long-term for certainly the behavioral health side and the fact that people need human contact and human touch to feel good about themselves.
Right. I want to delve into a little bit of Kindred's growth strategy, but before we get there, as you said earlier, you're dealing with federal government, you're dealing with 46 different states. Can you just talk about sort of your government operations approach? And every state was approaching this in a different way, some more aggressive than others. So how did that impact you? And what were some of the things you learned from that?
Yeah, well, that's right. I mean, you could argue that amongst all of the challenges, getting over the regulatory hurdles in all of the states that we operate with, and in what was happening with the federal government, uh, particularly early on, were as massive as any of the issues, Matt, that I think we were dealing with. So first, from a Kindred perspective, we do have a very robust government relations strategy and infrastructure that we've set up. I mean, as you would imagine, if your largest payer is the federal government and your second largest payer is probably state governments in most of the states that you do business with, we have to spend a lot of time with regulators and with legislators, talking about and making folks continually aware of, where are the barriers, where are the hurdles, where are the things that we need to have happen. And it was incredibly complicated as we went through the COVID-19 pandemic in the early stages, dealing with state legislatures, all of whom seemingly were making different decisions. Even today, you have certain states where there are quarantines, certain states that were making patients go to certain areas, certain states that weren't allowing things to happen, and it was complicated. We're lucky that we had built over the years, as I said, a pretty robust infrastructure. So we really have state representation in maybe not all 46 states, but certainly in the 20 biggest states that we operate: California, Florida, Texas, New York, New Jersey, places like that. We have a pretty in-depth approach to how we talk to state legislators and regulators, and we did our level best to make sure that we were communicating appropriately. And then on the federal side, we spend a lot of time in Washington, a lot of time at CMS, a lot of time with HHS, thinking about not just the effect on our business, but around what could they do from a regulatory hurdles perspective. And obviously the declaration of the healthcare emergency and some of the things that the federal government has done have been very, very helpful in smoothing, what I would say were some of the bureaucracies that early in the pandemic, created some real friction around how fast and how well we could move patients from one setting to another. So, our infrastructure, as I said, we have a lot of folks and a lot of time invested in that, relationships that we've made over the last decade plus, and it really served us well, I think, in terms of our ability to advocate on behalf of our patients.
Got it. So let's shift a little bit to Kindred's strategy, growth strategy. Obviously, COVID has impacted, as you said, COVID's impacted everybody financially, but doesn't seem to have stopped your approach to some partnerships and acquisitions. You've had some announcements over the past couple months. Even we've expanded some of your footprint. What do you see for Kindred over the remainder of 2020 and 2021 even?
Well, as you know, over the last decade, Kindred has evolved in lots of different forms and facets. But really, when you go back, a couple of years ago to our decision, our board's decision to take the company private and essentially sell our home health and hospice company to ultimately what will be to Humana, as they will own it outright, we really decided that we wanted to be focused on being really the largest, what we call specialty hospital company in America. We have tremendous infrastructure at the enterprise level to be able to manage and maintain running lots and lots of these, 60 to 80 bed specialty hospitals across the country. Today we have, almost 200 of those facilities in the number of states that we operate. And one of the things that we've learned in the operation of our specialty hospitals is that having close and direct relationships, and in many ways partnerships, with the short-term acute care health systems in those local markets is really the key ingredient, not only towards our success, but also towards that local health system's success in the context of how do they position and move patients from one setting to another as seamlessly as possible, while having real joint venture and partnership relationships help them do that. And also, every health system across the country, is limited in terms of the capital that they can deploy on building new sort of specialized hospitals, whether it's a long-term acute care hospital or an inpatient rehab facility or an acute behavioral health hospital. And so we have found ourselves, Matt, at sort of the intersection of the growing need in terms of a very small portion of the, let's call it Medicare population. It's more broad than that, but let's call it the Medicare population that is really the smallest part of the population, but it's using up the vast majority of the resources and the cost of where the Medicare and Medicaid spend in this country is coming from. And we are positioned at that sort of the tip of the spear, if you will, in that end. And so hospitals have been looking to us over the last number of years to help them develop a strategy in partnership with some of the specific skills we have with a lot of the local market relationships and brand that those hospitals have. And what's happened is it's been interesting as the years have gone on. You have one partnership and then that partner tells another partner, hey, they're a pretty good partner to have. And then you have another partner and then another partner. And it has grown in almost a cellular fashion where I think it's safe to say that not that other people aren't doing great things across the country in the space we're in, but I really do believe in many, many, if not most of the markets that we operate, we have become a partner of choice for health systems when they are thinking about developing these kinds of specialty services. And we like the model a lot because we go in as 50-50 partners for the most case. We keep the local health systems brand, on the wall. We help to bring, as I said, the enterprise level sophistication for how to run these. We get them up and running quickly. We get them up and profitable quickly. We provide great needed care in an environment where the health system may not have been able to do that as quickly as they would have liked on their own. And we have more growth, Matt, I think, than we almost sometimes know what to do with. We've already announced and we're in the process, we're going to bring 8 new rehab hospitals out of the ground next year. We're probably going to do that again the year after and maybe the year after that. Once our partners have gotten really comfortable with our approach on the rehab side, they've wanted us to continue to expand our services into the behavioral side. And so, we've recently made a number of announcements on that front, and we expect to see that grow very quickly. We're also, rationalizing and managing our current portfolio. So, for instance, we opened this year in 5 of our long-term acute care hospitals. We opened up what are called acute rehab units. So that's essentially an inpatient rehab hospital inside of an LTAC. We have 5 today. We expect that we'll triple that over the next couple of years. And so in partnership with hospitals and mostly around organic growth, we think that our path to growth is really, really exciting in a really complicated area where you've got, as I said, this very complex, multiply comorbid, very sick patient who needs a specialized kind of care. We do it faster, more qualitatively, and more cost effectively than almost anybody does in the country.
So really, it sounds like no slowdown in your growth strategy.
No, I mean, I think we were, and I think your question, brings up the right question. We were certainly concerned in the early stages of the pandemic about, where people's attention span would go, regulatory agencies, things that we need for approvals, what would happen. But knock on wood, we've been fortunate. It hasn't slowed things down at all. In fact, if anything, I think it's been more of an instigator towards we need to do this faster and we need more.
Interesting, Ben. In about a minute we have left here, one of the concerns that's been brought up across the industry is the growth of private equity, venture capital into the industry. You mentioned going private. Can you talk a little bit about, the concerns that folks have had about sort of a profit-driven motive in private equity coming in, and what are your thoughts about private equity coming and making more of a play into the industry?
Well, look, I think private equity means different things to different people depending on what you're what bet you want to take. In questions like this, I try and fall back only to my own experience, to what have I experienced in the context of the last 2 years of being a private equity backed healthcare services company, if you will. And again, this comes off of having been a publicly traded CEO for many years, so I have a good perspective, I think, on how capital markets work on both of these. We chose carefully our private equity partners in TPG and Welsh Carson because we knew that these 2 partners specifically had, I would say, arguably the deepest well of experience and knowledge in having run and owned healthcare service companies for many, many years. I mean, you're talking about decades. And what they understand is the same thing that I understand, which is that quality is what drives financial results. Financial results are great, but if you're not following the mission and you're not following quality, you're not going to get those results. And I've been very pleased in the 2 years that we've been partners together, that on every circumstance in which we needed to make a decision between quality and profit, we have always made the decision on quality. Let me just give you a couple of specific examples. In the 2 years that we've been partners with the private equity companies that we are partners with, we have replaced all of our ventilator units at a multiple $1 million cost. We've replaced every bed in our facility at a multiple $1 million cost. We've added more than 25 CT scanners to our hospitals at a multiple $1 million cost. We've bought ourselves out of leases for hospitals that weren't performing well at a multiple $1 million cost. And our partners have in every single experience, put their money where their mouth is to make sure that we were delivering a quality product. And I
Right.
think if done the right way, that's where private equity can serve all of us in healthcare well.
Got it. Well, I appreciate your response to that. And Ben, thanks for taking time. I know it's very busy for you. You got a lot of things going on. We'd love to stay in touch. Obviously, as you're growing, we'd love to stay in touch on that and see what the future holds for Kindred. But again, thanks for taking some time today with us.
Great. Thanks, Matt. It's great to be with you.
Thank you and stay safe. I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of the Checkup.